Welcome to this presentation on reducing central line-associated bloodstream infections by Nicole Shaughnessy, RN, and Megan Orndorff, RN. Central line-associated bloodstream infections, also known as CLABSI, occur when bacteria or viruses enter the bloodstream through a central venous catheter. A central venous catheter is an access device placed into a large vein, typically in the neck or near the heart, when access is needed on a more long-term basis. CLABSI is a preventable illness when proper care is provided. Central line use not only increases the risk of infection, but also increases mortality rates among hospitalized patients. The purpose of this presentation is to propose policy changes based on best practice evidence found through a literature review. Barriers and obstacles will also be explored. The literature review was completed on 4 articles pertaining to the prevention of CLABSI. The following grid provides a summarization of the articles reviewed. The initial policy was reviewed, and based on the literature review findings, the following policy changes are being proposed. The following policy changes are being proposed to the committee to aid in the prevention of central line infections. Central line education will be increased for all staff. Central line infection prevention committee meetings will be more frequent so that more staff may attend. The implementation of a central line bundle kit trial to begin in the ICU. The central line bundle kit will be comprised of the following: 1 sterile package wrapping, 1 towel with 1 syringe with a cannula, 3 syringes, 1 end cap, 1 needleless connector, 6 prep pads, 1 blood transfer device, 1 specimen bag, 2 pre-filled sodium chloride syringes, and 1 tray. Evaluation of the central line bundle trial using evidence-based practice will be modified as necessary to achieve the desired results and compliance. Along with change comes potential barriers. Staff will be required to complete education, which may have to be done outside of their regular scheduled shifts. This could create problems for some staff as they may have families, transportation difficulties. Although the education hours will be paid to the staff as a benefit for them, administration may have a more negative aspect. Another barrier to 100% compliance is understaffing and heavy patient loads. Nurses may find shortcuts in order to save a few seconds during care. Missing one step could be the one opportunity for bacteria to cause havoc. Along with the current policy for central line infection prevention of hand hygiene, maximum barrier precautions, chlorhexidine antisepsis, optimal catheter site selection, daily review of line necessity, the central line bundle kit will also be proposed. To aid in the prevention and evaluation of central line infections, the central line bundle kit will be used on all patients in the ICU who undergo central line insertion. The bundle checklist will be submitted to the nursing care manager, who will then, after each use, review and report to the Central Line Infection Prevention Committee. All nurses will be responsible for any post-insertion follow-up with the Central Line Infection Prevention Committee, and any nurse handling a central line will be offered initial training, yearly competency, and as-needed breakthrough training. As a nurse, we have the opportunity to heal the mind, soul, heart, and body of our patients, their families, and ourselves. They may forget your name, but they will never forget how you made them feel. Thank you for viewing this presentation.